If you've ever felt self-conscious taking your shirt off, you're not alone. Gynecomastia, commonly known as man boobs, affects up to 65% of men at some point in time in their lives. I'm Dr. Albert Carlotti, a cosmetic and reconstructive surgeon in West Palm Beach with over 30,000 procedures under my belt. In this video, I'm breaking down exactly what gynecomastia is, what it isn't, and what you can actually do about it. It is really a hyperproliferation of glandular breast tissue in a male, and it typically forms deep to the nipple areolar complex, causes a protuberance of that tissue, and it's very unaesthetic. Men become very self-conscious about it. Chest fat is really subcutaneous fat above the pectoralis muscle. Easy liposuction and skin tightening, and we solve your problem. Gynecomastia, however, is really dense glandular breast tissue deep to the nipple. It's not really amenable in most cases to just liposuction alone. We need to actually surgically excise that tissue to give you back a normal male chest contour. If someone has chest fat only, can that be treated? Of course. We do liposculpture along with Renuvion skin tightening. The skin tightening is a very critical component using the Renuvion technology I have here at BellaNova Palm Beach. Without it, the skin just sags in the area where the fat used to be because the skin, particularly in a male chest, just doesn't tend to tighten on its own. Men who get heavy put fat inside their liver. That causes a dysfunctional liver and it converts testosterone to estrogen. They get higher estrogen levels in their body, which causes a hyperproliferation of glandular breast tissue. And after you lose the weight, it does not involute and go away on its own. It requires surgical treatment. Glandular breast tissue in men, or gynecomastia, is quite common. It's common, first of all, in youthful adolescents who are undergoing puberty. At that time, they have tons of testosterone in their systems throughout the normal puberty process, and some of it turns into estrogen, and they get some hyperproliferation of glandular breast tissue. However, most of the time, it involutes and goes away on its own. For those rare patients that have persistent glandular breast tissue, that's when they come to see me to have it corrected. The most common reason, however, why men have it is because of either improperly monitored testosterone treatment, they're taking too much testosterone without management of their estrogen levels, or they've been on other anabolic steroids that tend to cause this. Until we get their hormones under control, we're not going to see a stabilization of that. And if we do a procedure and they're still on those steroids without proper medical management, guess what? It'll just come back. A good candidate for the surgery is someone who's young and healthy, and importantly, someone who's going to follow my postoperative instructions exactly as we prescribe them. The postoperative protocol is critical to results and avoiding complications. But if you're healthy and we can control your testosterone levels and estrogen levels within safe limits, then you're going to be a good candidate, meaning once we do the procedure, it won't come back. First of all, it's a virtually painless procedure. The painful part is you following my instructions after surgery. We put you in a chest binder to keep compression so you don't rebleed in the area. We won't let you go anywhere near the gym. And if you follow those basic things, I will have you back to the gym in 2 weeks, back to your normal self. It should be permanent, but here's a caveat. We don't take out all of the glandular breast tissue in a male. Why? It's normal to have a thin layer of it just deep to the nipple, leaving some glandular breast tissue cells still there. If you go back on the anabolic steroids or you're on bro science testosterone that you get from some dude at the gym, you're probably going to have imbalances of estrogen, which will then cause the breast tissue to come back. So simply put, undergo proper medical management and it won't come back and you'll be happy. I'm an athlete, a competitive athlete in powerlifting and bodybuilding, and I'm around this a lot. I personally take testosterone replacement therapy. I have a doctor medically manage me. I don't decide on my own. I want my patients to know that I talk the talk, but I also walk the walk. If you want to learn from me, help me treat you by listening to my experience, both as a surgeon and as a competitive athlete. Gynecomastia isn't a willpower problem. It's a biological one. No matter how hard you train, glandular tissue doesn't respond to diet and exercise, unfortunately. So if your chest isn't reflecting the work you're putting in, it might be time to get a proper evaluation. Understanding whether you're dealing with fat, glandular tissue, or both is the first step towards actually fixing it. If you're having questions or want to explore your options, feel free to reach out to me at BellaNova Palm Beach, and I'd be happy to help you.